We're really glad to have you with us. We're just going to get started here as folks join. And then just want to introduce myself quickly. I'm Kylie Jackson with the Department of Healthcare Services. This is the Hearing Aid Coverage for Children program webinar for September. Welcome back to school, everybody. If you've got kids that age, or if you're that age. I'm going to be sharing a PowerPoint here so you can all see, and then we also use the question and answer feature in these webinars, so you can drop a question into that Q&A box if you have a question for us along the way. Some of them I'll be able to answer as we're going through particular topics, and anything that we don't get to chat about at that stage, we'll go ahead and chat about at the end as well. Go ahead and share the PowerPoint so you can see this.
I'm sorry, can you speak a little bit more clearly?
Yes, I will try to speak up as well. PowerPoint was doing a funny thing. Okay, here we go. Okay, I'll make sure I can see your questions as we go through, and then we'll go ahead and get started here. This will be recorded for anybody who has to drop out at a certain point, so you'll be able to see it afterwards. We do have real-time captions available throughout today's webinar, and those are available at a separate URL, which we will be putting in the chat a few times throughout, so you can see it there. I'm just going to grab that one more time. Then we also have ASL video relay available in today's webinar, which should be pinned to your stage. If it's not, then you can go ahead, or if you need to adjust the pins on your personal stage, you can go ahead and use the pin button within your view of WebEx. I just want to touch on a brief history of the program. HACCP is relatively young in terms of California state programs. It just launched in summer of 2021, but we're growing. We've expanded our eligibility already. Had a major expansion at the beginning of 2023, which we're very excited about. And if you've ever been enrolled in Medi-Cal, this is very similar to fee-for-service Medi-Cal, or if you have experience on that side of things. It also borrows a lot of the expertise that has been established for the California Children's Services, which offers coverage for specialty healthcare needs. HACCP has a dedicated support team with a program-specific provider locator to help you find a participating provider in your area, and offers an online application portal with secure login. So we'll talk about all of those as we go through. HACCP covered benefits include a full range of hearing aid related benefits, all the way from evaluation, that's your otolaryngologist or ENT and audiology visit, all the way through to follow-up. It also includes hearing aids themselves, whether conventional hearing aids or assistive listening devices, ALDs. That's similar to the HACCP systems you might be used to using for school. Surface-worn bone conduction hearing devices, or BCHDs, which we'll talk about a little bit more in detail further in. Medically necessary hearing aid accessories and supplies, like ear molds, batteries. And then we did mention the hearing aid related services and appointments, so audiology, physician, including specialty like otolaryngologists. For a comprehensive list of specific benefits and procedure codes, which, just in case your provider might ask for those details, those are available in the HACCP provider manual that we have linked here. And then coverage determinations, which we'll talk about a little bit more in a moment regarding treatment authorization, are all based on medical necessity. So HACCP is available. The eligibility criteria for this particular program are that children must be under 21 years of age, California residents, household income needs to be under 600% of the federal poverty level, and that doesn't necessarily mean a whole lot to a lot of people, so we'll talk dollar numbers in just a minute here. But it varies depending on the number of people in your household. And then not have health coverage for hearing aids. So if you're eligible for Medi-Cal, we want you to get the full scope of Medi-Cal benefits, not just the hearing aid coverage, right? So we'd recommend you apply directly to Medi-Cal. Similarly, if you're already enrolled in California Children's Services for a hearing-related condition, you're going to have all of these benefits and additional wraparound benefits. So there's no need to switch programs. If you're enrolled in a health plan, and that plan does not include hearing aids, or it limits annual benefits to $1,500 or less that are related to hearing aids, then HACCP is available to provide supplemental coverage. So your provider would bill your regular health plan first, and then would bill HACCP for anything left over, rather than having the out-of-pocket be billed to you. Similarly, if you are uninsured, that would mean you don't have health coverage for hearing aids, so that would meet this criteria as well. Enrollment does require a referral from a medical provider or hearing professional, or a valid hearing aid prescription. And that's just helping make sure that we get you matched up with the right program for the type of benefits that you need. So the referral is, we actually have a nice little form that's available on the webpage. That's just an easy one-page form for the hearing specialist, whether it's somebody doing a hearing screening at your school or at the hospital or within a normal pediatrician visit. They can go ahead and just fill this out and sign it, and you can use that if you don't have a current hearing aid prescription. And that's really nice for the earlier stages where, oh, this is just a referral for the hearing aid evaluation itself, or for the initial, audiology, follow-up, physician follow-up, so that you may not have gotten all the way to getting a hearing aid prescription yet, but we want you to still have coverage for those earlier services as well that get you toward having a hearing aid prescription. HACCP eligibility on the income side of things varies depending on the household size, including parents. So we've got a nice little comparison chart here of what the eligibility range is for Medi-Cal for kids, what it is for CHIP, which is expanded income-based eligibility in certain counties to access Medi-Cal benefits for children, and then HACCP. So this is the max income for each of those programs. So if you're a family of 4, just to use this as a quick example, in most of California, if your income is under $82,992 a year, children would have access to Medi-Cal for kids. And this is for under 18 years of age or younger. Similarly for CHIP, same ages in certain counties, so usually more expensive counties, right? San Mateo, San Francisco, and Santa Clara counties. You can go all the way up to $100,464 a year and still be eligible for the Medi-Cal benefits through the CHIP eligibility. If you're, depending on which county you live in, if you're above that relevant Medi-Cal threshold, either for Medi-Cal for kids or CHIP, but you're still under $187,200 per year, that's going to be that sweet spot range that you would be eligible for HACCP. So we're basically taking the hearing aid related benefits that are already available through Medi-Cal. We're saying, okay, these are now going to be available through this, think of it as like an extension program up for this additional income range. Hopefully that made sense as an example. If you have a specific question, you're welcome to drop it in the Q&A, and we'll touch on those. We also have an HACCP Help Center that I will provide all the contact information for at the end, and they can walk you through anything specific, particularly if you want to walk through a more personalized fact pattern. These are the people in my households. Does their income count or not? Those sorts of questions. The Help Center is going to be an excellent resource for you on. Okay. The enrollment process, we try to keep very simple for you. So you can apply online. Go to haccp.dhcs.ca.gov. You want to make sure that you have handy your household income documentation and it'll walk you through which types of documentation are relevant depending on what your income source is. Existing health coverage. So if you have, say, coverage through a commercial plan already, you're going to want to show us your explanation of coverage document or explanation of coverage summary. Sometimes we'll get specific enough. And then if it doesn't already say your the covered individual's name somewhere on that document, you would also go ahead and attach a picture of the applying child's insurance card so that we know the name matches up with the plan that is being described. And then the hearing aid prescription or provider referral, either of those, and you just upload those all within the online application. If you do prefer to submit an application either by mailing a paper form or filling it out and then uploading it, you can go ahead and let the HACCP Help Center know as well, and they'll be happy to get you a copy of that. Or you can go to the Apply for Coverage link on our main webpage, and it will give you additional information about applying for coverage, including links to the English and Spanish form. Eligibility is determined within 10 days from receipt of a complete application. You'll typically hear back from us by mail within that 10 days. So if you have any questions when you get your enrollment response, whether that's the welcome letter with a program ID card, or if it's a notice that we need additional information in order to complete your enrollment, just go ahead and let us know. If we do ask for additional information, if there's information missing in your application, please note that there is a timeline to get that into us. The applications time out after 60 days. Once you're enrolled, or if you're thinking about enrolling, you just want to check, hypothetically, who in my area could I go to? We do have several providers who participate in the HACCP provider locator. This is specific to HACCP and leans more towards providers who are currently accepting new patients. What we find a lot of the time, though, is that your existing provider likely already accepts Medi-Cal fee-for-service and is able to bill through HACCP just the same way that they do through Medi-Cal. So if you already have a pediatric audiologist or otolaryngologist helping your child, touch base with them first. You may be able to keep that continuity of service. And if they already work with your primary insurance as well, if you have primary insurance coverage, then that keeps things like really nice and smooth. Enrolled Medi-Cal fee-for-service providers, whether or not they're in the provider locator for HACCP, can submit claims for covered benefits provided to HACCP clients using the same process they already use for fee-for-service Medi-Cal and California Children's Services, or CCS. If the provider is not already enrolled in Medi-Cal, they can learn more and apply online. And we included a link for our PAVE system, which is the provider verification and enrollment portal. Once you're enrolled and you've selected a provider, you're taking your child to their first appointment, or maybe attending your first appointment directly, you want to bring a few things with you. And these are easiest if you gather them as you go along. And one of the simplest but most effective recommendations we've gotten from the providers that we work with is to just keep a folder in one place that has all of your hearing-related medical documentation, your HACCP ID card, your health insurance card if you have other coverage, all of the documents from earlier appointments. So if you've already seen an otolaryngologist and you have your hearing aid prescription, keep that in there. It generally does not, for hearing aids, look like a normal script. It's much more likely to, be a printout, conclusion within, say, the notes from your visit. So like if you go into a patient portal for most of the like clinic systems these days, you'll be able to see exam notes, patient information for after your visit. A lot of the time it'll be in those documents. You also want to save that medical history and examination notes from your otolaryngologist exam specifically, where it talks about doing the head and neck exam, going over medical history that's going to be relevant, all of those pieces, and whether there's medical clearance for hearing aids. That documentation is going to be really important for you to be able to share with your child's audiologist so that they can get authorization to have the hearing aids provided. Hearing aid recommendations and audiologic reports, kind of as you go along the path, like just, gather all of these together. You're going to want to provide them to the dispensing audiologist for your hearing aids or your child's hearing aid, so that they have everything they need to make that go quickly and smoothly for you. Depending on your specific needs or your child's specific needs, your child's or the enrolled provider may request additional documentation. Sometimes there will be a provider-specific form just to put everything in place, or another request, that's specific to a particular need. Maybe there's an accessory that's relevant, but we really need to know which specific other components you're already using so it can be compatible, things like that. So we just always kind of build in that extra bullet point. So if your provider or your child's provider does request additional information, that's still very important as well. We mentioned briefly the treatment authorization request or TAR process. So Medi-Cal uses TARs and HACCP uses the same process to support appropriate use of covered benefits. Some benefits always require a TAR for medical necessity. So hearing aids, for example, will always require a TAR, whether they're new or replacement. And other benefits only require a TAR after a certain quantity, or some not at all. So ear molds are an example of, a TAR is not required unless the individual needs more than 2 ear molds at a time, or more than 4 ear molds within the same 12 months. DHCS does anticipate responding to most TARs within 30 days of receipt. I'm not one of the TAR reviewers, so it's not, rude of me to brag on them as a third party that they do a really great job of responding sooner than this, and are also very dedicated to making sure that we approve every TAR we possibly can to get, kids hearing aids and get them approved quickly. So if you have any questions about what documentation is appropriate to include with a TAR, if you have, just in case we've got any providers here with us, we always want to drop this, or if you've got any questions about, should I bring an extra document to, my visit, or what kind of hearing aids are covered, those kinds of things, let us know. We're happy to work with you. We do have a separate quarterly webinar series for providers, where we also go into this a lot more in depth. So if you are a provider joining us today, please note we do have a more comprehensive resource available on these TAR instructions and guidance, and additional provider-oriented guidance available there as well. And you can always call us with questions. For new hearing aids, your child's audiologist or the dispensing audiologist needs to include these documents when they submit the TAR. You'll notice these are very similar to what we mentioned, need to be brought with you to the first appointment. Hearing aid prescription from an otolaryngologist or an attending physician if there's no otolaryngologist available in your community. A signed medical history and physical examination by an otolaryngologist. Signed audiologic report and hearing aid evaluation, this is typically from your audiologist. And specification of the ear to be fitted. So the 2 audiology documents at the bottom are sometimes part of the same document. And the 2 first items, the prescription and examination notes, may be part of the same document. That's fine. We just need to make sure that all of those 4 components are somehow sent to us with the TAR. So if you bring them to your dispensing audiologist, then we're able to facilitate an even faster approval for you. And it means less back and forth requests from your audiologist for you to get an additional resource from a prior provider as well. Some of the frequently asked questions we hear are, for example, if your child is already in enrolled in CCS for a hearing related condition, should we switch to HACCP? Like, no, in this particular set of circumstances, newer would not necessarily be better. CCS has much broader access to funding, so they're able to provide much kind of deeper and broader sets of services, including wraparound services that can help coordinate other aspects that are related, but not, let's say, less directly related to hearing aids specifically, but are still very relevant to your child's hearing and language development. So if your child is enrolled in CCS coverage for a hearing related condition, they would not qualify for HACCP. The one caveat that I will mention, that because CCS enrollment is condition specific, if your child is enrolled in CCS for a non-hearing related condition, you can go ahead and apply to HACCP at the same time you're applying for service authorization for a hearing related condition, or if your service authorization request is denied for a hearing related condition, just because CCS does have some very specific criteria they need to follow about which testing thresholds qualify for that type of coverage. So if you have CCS coverage not related to a hearing condition, or you don't yet have it related to a hearing condition, you can certainly still apply for HACCP almost like on an interim basis, or to kind of bridge that gap. We just don't want you to have we don't need to waste your time applying for something that's going to duplicate benefits you already have if your CCS coverage is hearing related, if that makes sense. My child has partial insurance coverage for hearing aids. Do they qualify for HACCP? So potentially, starting at the beginning of 2023, families can also now apply for supplemental hearing aid related coverage through HACCP, but your provider will bill your insurance first. How do I find my insurance plan's explanation of coverage? So, and this goes back to the documents that need to be provided with the application for enrollment, right? So you should have received an explanation of coverage document when you first enrolled into your commercial insurance plan. You can also call your health plan's member services to request they send you a copy. Some of these I've also noticed are getting sent out electronically now. If you opt into like virtual notices and things, you might have a notice that somehow ended up in a spam folder or similar. So if you search your email, you may have like an electronic link to a portal where you can download the coverage document. If your child needs a bone conduction hearing device, are these covered? So yes and no. BCHDs fall into two main categories. There are surgically implanted BCHDs. Those are not included within HACCP coverage because they're typically already covered within your commercial. Similarly, if you do need a surgically implanted BCHD, you're extremely likely to qualify for CCS coverage that would include these as well. HACCP only covers surface-worn BCHDs. So these are the ones that don't have any sort of surgical aspect, but they are worn like on a soft band on the outside of the head. Sometimes you'll see them adhered like with a little sticker. This type of device, if it's externally worn or surface worn, would be eligible for coverage, but they do require a TAR approval, just like any other type of hearing aid. Do parents need to pay out of pocket for HACCP covered services? So no, it's actually not allowed for providers to bill HACCP members, just like it's not allowed for providers to bill Medi-Cal members. Participating providers will instead bill HACCP directly for covered benefits, just like they do for Medi-Cal and CCS. If you have partial coverage through a health insurance plan, your provider must bill your insurance first, right? And if there's like a co-insurance amount, or if there's a max coverage, which there would be if you're eligible for supplemental coverage through HACCP, then they would bill that remainder that wasn't covered by insurance over to HACCP or DHCS for the same fee-for-service payment system that works for Medi-Cal to reimburse the provider. So none of that would go through you. You don't have to wait for reimbursement. It all gets paid directly to the provider. But they must be enrolled in fee-for-service Medi-Cal in order to utilize that billing and payment system. Is authorization needed in order to see my HACCP participating audiologist? So HACCP does not require prior authorization before any benefit. In the case of treatment authorization requests, we can process those before or after a service is provided. They just have to be approved before the provider can get reimbursed for whatever that benefit was. So because of that, providers may have different policies. A lot of the time, what we find is that there's no need for authorization before a provider does testing, for example. They'll send in that TAR afterwards, and they'll use the test to say, look, there was a need for the testing. But for something that's more expensive, like the hearing aid itself, it's a bigger deal if they need to switch it out when they've already dispensed it to you. So we'll often have that treatment authorization request go through ahead of time so that if there's any additional information that might help you get a better hearing aid that actually fits your needs even better than they may have realized was coverable or something like that, then, or if we need an extra answer to a question about why this is the right fit, things like that, that would usually go through pretty quickly, but before the hearing aids tend to be dispensed. What happens if my child's application for HACCP enrollment is denied? So if your child does not qualify for HACCP, you will get a letter that explains why, which eligibility criteria were not met, how to request reconsideration of your application if you feel there was a misunderstanding or if your circumstances have changed, and other programs that might help. Additional resources available. We'll go through quickly as well, and then we've got some questions to go through as well. So we've got the HACCP Help Center, runs during extended business hours Monday through Friday, and then Saturday mornings as well. You can call them at 833-774-2227. They do have translators available in many, many languages. And they also offer video relay and TTY, TTD. You can chat online. This is available in English or Spanish. The online chat support is secure, but it's also limited to the same HACCP Help Center hours. There is a feature where you can upload documents. So if, for example, you got a letter from us that said, hey, we're missing this part of your application. This page, must have gotten separated before you put in the envelope and mailed it to us, or something to that effect. You can upload the missing document securely 24/7. It's all HIPAA compliant, secure, protecting all of your medical information. If you've got any questions about that, the Help Center can also assist with any of those inquiries. You can also email haccp@maximus.com, but typically we usually recommend calling or chatting online as getting like the very fast support. The HACCP webpage, the same one that has the chat available, actually is dhcs.ca.gov/HACCP. On our webpage, you can learn more about the program. You can find resources, flyers, information for community partners. You can, click the link to apply for coverage on our online application portal. You can find a participating provider. And then here's the direct URL for the applying online for coverage as well, is just the hacccp.dhcs.ca.gov. So you put the HACCP in front instead of at the end. Basically the difference. We do also have information. One of the things that's a newer addition to our webpage that I want to highlight, that when you enroll in HACCP, coverage is typically effective for 12-month period from when it started. So if you are enrolled on September 12th your coverage would be effective from September 1st, 2024 through the last day of August in 2025, unless you turn 21 in between there, and then it would end the month you turn 21. So at the end of that 12-month period, or toward the end of that 12-month period, you get a letter from us, and you start hearing from us a couple of times if we haven't gotten your documentation back yet, saying, hey, your coverage is only good through this date, but we want to be able to keep giving you coverage longer than this if you're still eligible. So can you send us this additional information to make sure you're still eligible so we can enroll you in an additional 12-month period? That's called the annual eligibility review process. Sorry, I was missing a letter of the acronym for a minute. So it's AER is the acronym that you'll see a bunch of places towards the end of your 12-month eligibility. That is us. It's not somebody pretending to be us. So go ahead and just make sure, if you're still eligible, if you're planning on needing coverage for the additional subsequent year, that you get the AER process sorted out timely. So we try to keep it as streamlined as possible because we know you're busy. But that is really important so we can keep your coverage going, especially if you're going to need additional ear molds, batteries, whatnot during the coming year. So we can just make sure you've got continuous coverage. Looks like we do have some questions here. Thank you so much for joining us. We're going to touch base on these questions. I'm going to stop the screen shares so I can see these better. The question: for a family of four, where one of the parents is temporarily unemployed, without health insurance or COBRA coverage, applied for Medi-Cal, but still waiting to hear back. We need to change your child's ear molds in the meanwhile, but don't have coverage yet. Okay, so depending on what other income is in the family, you may still qualify for HACCP, or you may qualify for Medi-Cal. If you qualify for Medi-Cal in your county, you won't qualify for HACCP. But if you're not sure whether your annual income, a lot of the documentation might be from last year, you may be able to apply for HACCP based on the most recent available documentation, without additional specifics that you probably don't want to review publicly, just because we want to respect your personal information. I couldn't tell you for sure whether you would need to go the Medi-Cal route or the HACCP route, but you could certainly apply for both, and we might be able to get a response back to you quickly, at least to confirm, oh yes, you're not eligible for HACCP because you fall within the Medi-Cal eligibility range. Or, you know, depending on the specifics, like I said, it's possible you do still qualify for HACCP anyway, and we might have good news for you more immediately. Okay. There might also be a question in the chat. What documentations are usually needed for the AER? Okay, so AER uses the same documents that are required for the initial program enrollment, except that you would not need to resubmit a prescription or provider referral document. So you would still need to let us know your current health insurance documentation, and you would need to provide any updated income information. So those are the two main sets of documentation. And then I have another question here that says, is there an income limit to qualify for this program? So yes, there is. It is 600% of the federal poverty level is the maximum income. And then the Medi-Cal maximum income, and for your age and county, ends up being the minimum income for this program. So it'd be, if your income is higher than Medi-Cal, but lower than 600% FPL, that's the sweet spot. And I'll pull up the slide in just a moment here. Let's see. And then these are also available in the program resources as well that were uploaded for the webinar. So you may be able to download resources through WebEx in the participant menu. So for a family of 4, you would look at which county you're in and whether the applicable like Medi-Cal benefits maximum is either $82,992 a year for most of California or $100,000. I'm sorry, $100,464 a year if you're in a C-CHIP county, that's San Mateo, San Francisco, or Santa Clara. And if your household income exceeds the Medi-Cal threshold, but is still under $187,200 a year, that's that sweet spot for HACCP eligibility, again, for a household of 4, including the parent. So if you've got any questions about whether somebody counts as part of the household or anything like that, the Help Center is also available to assist with those. Oh. Not sure where this went. Okay. All right. Can you still hear me, hopefully? Okay. A little technical snafu here. Right. So we have another question in the chat. The problem many of my families are having is when calling, and if I could please, if you've got any questions, could you please put them in the Q&A? I'm going to try to clear out these ones that are in the chat, but it'd be helpful if we could find them in one place, because that helps us build out our FAQs for future webinars as well. Okay, so this question is, the problem many of my families are having is when calling an HACCP provider, they're asking for a referral. Most of my families have Kaiser, and Kaiser won't write a referral to an outside agency for this. So some Kaiser providers will write the referral. It may be a different type of referral than what you're thinking of. There are also some distinctions between whether there's a situation in Northern California or Southern California. So Shelley, if you've got a specific instance, I think it might be really helpful for us to connect outside of the webinar so I can provide some more direct resources based on what the family situation is. Just so that I want to be able to get you support with whatever this instance is. So just for informational purposes, there are differences between the referral that HACCP uses, which is fairly straightforward. This individual needs a hearing aid or hearing aid evaluation, and then who has the expertise to say, you know, a screener, for example, might be referring somebody to further hearing aid evaluation. Whereas, you know, determining that an individual needs a hearing aid might be coming from somebody with more clinical experience, making that determination after, say, a hearing aid evaluation or otolaryngologist visit. So this is just a referral. You know, they need hearing aid related services generally. Anything from an initial evaluation on down the line, just to enroll in the program. But this is a relevant program for this individual, which is, I think, potentially different than referring to a specific provider. So hopefully that helps. If you've got a specific instance, so like I said, like let's chat about where, you know, the family might be located, and I can see what I can do to help you. If I've got any other questions buried in here. There was also a question about in the scenario you were discussing earlier.
Sorry, can you please speak clearly?
Yes, thank you. In the scenario discussed earlier, where an ear mold was needed, but they were in process of getting eligibility approval, could they pay for the ear molds and submit for reimbursement after? So no, HACCP is only able to reimburse enrolled providers, not families. So good question. see if there was another question here. How fast is turnaround time for decision for HACCP? We're talking about the enrollment determination. That's typically less than 10 days from when we receive your complete application until we confirm your eligibility and send you, an outcome letter in the mail. So either a welcome letter to the program or an unfortunately, you're not eligible at this time, but let us know if maybe we misunderstood something in your application and we need to reevaluate it, or here are some additional resources for other programs that may be able to assist you. Most of the time, if somebody gets that letter, it's, so you're not eligible for HACCP, but the good news is you're eligible for Medi-Cal instead, which gets you even more benefits. So it ends up not being bad news, even though it sounds like it's going to be. If you're mentioning for the treatment authorization request, that determination would be the same as for Medi-Cal. It's typically under 30 days, unless there's additional information that we need to request from the provider. Do you have any other questions that we might be able to clear up for you? You can just pop them into the Q&A. Otherwise, you can also go ahead and contact us at the Help Center or check out the webpage. We'd be happy to help you more outside of the webinar as well. So I'll stay here for a few more minutes in case there are additional questions. Very nice to chat with you all today. I hope this was helpful for you. We do have, I believe, a survey should pop up for you as you leave. So we would definitely appreciate your input there. Help us know how we can make this even better for future events. Are we going to receive the slides? So those are actually in the webinar resources. You may be able to download them as from the webinar content, but we'll also be posting them on the webpage. So that link, again, let me pull this up for you. It will be at the HACCP events archive. It will also be announced on the HACCP homepage. So let me go ahead and use that URL actually. Just typing that into the Q&A so that you've got it available. And then if there are any other questions, like I said, we'll hang out a little bit longer. We've technically got until noon. So please feel free to let us know if there's anything else we can help with here, or we can chat offline if that would be helpful as well. If you've got a more specific question, we can go ahead and help you privately outside of this forum as well. So thank you very much, and we really appreciate you joining us today. Okay.